Hey guys, first of all, Assalamu alaikum wa rahmatullahi wa barakatuh to all the respected members of the Your Health Consultant group and all dear viewers of this video. I most welcome you all and today's topic on GERD or Gastroesophageal Reflux Disease. This is a very common condition all over the world in adult population. It affects approximately 16% of adults in the world. GERD or gastroesophageal reflux disease is a medical common condition in which there is backflow of the gastric acid and the stomach contents into the oral cavity and into the esophagus, which damages the esophagus and the esophageal mucosa, and in the result it causes heartburn or burning sensation behind the breastbone or sternum and dysphagia or difficulty in swallowing, as well as it results in backflow of the gastric contents into the oral mucosa or into the oral cavity, which is called in medical terms regurgitation. There are some causes for developing of GERD. The one most common is the lower pressure of the lower esophageal sphincter or the lower pressure of the gastroesophageal sphincter, the normal range of which is between 18 to 45 millimeters of mercury. In this case, the sphincter, the lips become distended, particularly during eating too much or after meals. When the sphincter becomes distended, the gastric contents, the gastric acid flows back to the esophagus, damages the esophageal tissues, and causes heartburn or burning sensation behind the sternum or behind the breastbone of the chest. The second cause is hiatus hernia, or in other means sliding back of some part of the upper part of the stomach into the chest, into the esophagus, which causes backflow of the acid to the esophagus and causes of heartburn. The third cause is scleroderma in medical terms, which is also referred that when there is connective tissue, when there is abnormally developed connective tissue in the esophagus, particularly in the muscular tissues of the esophagus. So the esophagus loses its contractile function, the sphincter becomes distended, the esophagus becomes rigid, and there is backflow of acid into the esophagus, and consequently heartburn and dysphagia or difficulty swallowing develop. Also, there are some risk factors for developing of GERD. For example, the most common risk factor is smoking, as well as eating too much is another risk factor for distension of the lower esophageal sphincter and flowing back of the gastric acid into the esophagus, and for developing of the heartburn or burning sensation behind this chest bone or behind the breastbone, which is called sternum. Additionally, taking of analgesics, especially the non-steroidal anti-inflammatory drugs like diclofenac, like ibuprofen, naproxen, celecoxib, these all stuff cause peptic ulcers, gastric ulcers, increase in the acid of the stomach, and consequently the backflow of the gastric acid into the esophagus and in developing of heartburn and difficulty in swallowing. Other medications like antihistamines, like cetirizine, like fexofenadine, like Avastin or loratadine, all these cause heartburn or generally GERD in patients who are taking these medications. Moreover, steroidal drugs like prednisolone, like methylprednisolone, and other stuff of steroids cause heartburn or increase in the gastric acid of the stomach and reflux of the acid into the esophagus, and consequently it results in GERD. Eating too much is the most important and the most common risk factor for GERD. If GERD is not treated, so some life-threatening complications might develop. For example, abnormal development of intestinal tissue in the esophagus, which is called Barrett esophagus, which is the harbinger, might be the harbinger for esophageal cancer or esophageal adenocarcinoma, the most life-threatening, fatal complication of the GERD. GERD is very common, and also some people are seeking medical attention for this. Second complication, if GERD is not treated, is esophageal stenosis, narrowing of the esophageal lumen, and consequently it results in difficulty in swallowing, which causes dysphagia, also called dysphagia, or difficulty in swallowing eating. There are some treatments for GERD which is commonly used all over the world among adults. The one most commonly used is proton pump inhibitors like esomeprazole, omeprazole, pantoprazole, lansoprazole, or all these medications are called PPIs or proton pump inhibitors. They are used in daily basis for relieving the symptoms of GERD, which is heartburn and reflux of gastric contents into the oral cavity. There are some relieving measures for the reduction of the GERD symptoms, for relieving of heartburn in patients of GERD. That is, avoid smoking. Do not use cigarettes and alcohol. Avoid eating too much. Avoid eating spicy, fatty, and oily foods. Avoid taking analgesic or pain drugs, painkillers. All these cause GERD and heartburn in patients. Also, while you are sleeping, put your pillow a little bit higher, about 6 inches higher than usual. All these measures will relieve the symptoms of GERD, like heartburn. If someone apply these measures in their lifestyle, in their life, if they change their lifestyle as I mentioned, so they will not experience the symptoms of GERD. Dear viewers and dear fans and colleagues, for the next topic, we will discuss about different medical conditions. Be with us, join with us through your health consultant group. Thanks for watching.